Welcome to the Architect of Resilience podcast, where we explore the secrets of overcoming life's challenges and unlocking unstoppable strength through deep personal conversations and expert insights.
I wanted to give you a heads up that this episode of the Architect of Resilience podcast is going to be a little different. The reason for that is it wasn't originally intended to be a public video. So I have the private community, which most anyone can join. It's a free. That is on, the link is on the education and community. There should be a comment, a link here down in the notes, or on the website, chrisduffin.com. If you go there and go to education community, you'll be able to get access to our member forum. We have about 2,000 members, and the paying portion of those members, so again, the forum is absolutely free, but the paying portion, we have regular live calls that are just for those members. And Dr. Rahul Desai, who has been on prior podcasts with us, joined for one of those sessions. And I really felt that this one should be open to the public. So we recorded this a couple months ago, and I've been sitting on it because, well, the quality of the recording from a video aspect isn't normally up to par. And you're also going to see some other people interacting, asking questions besides myself. So I just wanted to share the format of this video and why it's a little bit different, but I think that you'll get some tremendous value out of this piece, which is why I wanted to share it. So just a little heads up on why the look and feel is a little bit different than the remainders.
Hi, everybody. I'm Rahul Desai. I've been working as a regenerative musculoskeletal, like joint and spine radiologist and regenerative doctor for approximately from about 2008. So 17 years or so, and really focused on using platelets, autologous substances, so patients' own bone marrow and fat. That's my primary tools for regeneration. And then using my diagnostic skills as a radiologist to figure out what's going on with somebody, obviously seeing them in the office and clinic, and then placing those materials with image guidance into structures that could potentially, benefit from that. So any ligaments, tendons, joints, bone, cartilage, discs in the spine, and lo and behold, it actually helps those tissues heal. So in the right setting, we don't need surgeries, we don't need other interventions. Sometimes it augments surgeries. That is, somebody needs a surgery, it'll help it heal better. And then in that time, have delved into other areas of regenerative medicine. So, obviously the healthier the body is, the better the body heals. And we want our patients to do really well. So I've been very interested in all different sorts of, medicines. We had a functional medicine doc for a long time. We had trainers, mind, body, health. We use a lot of energy-based medicine nowadays. Have been using shockwave for a long time, and then, basically got my master's degree in the last year and a half in red light therapy. It's a proverbial master's degree, but it really took a deep dive, worked on starting a company. It's called Red Vibe Health, and, really exciting with kind of mitochondrial health and activation and leveraging that to heal. So that's kind of my background, and, became friends with Chris in the last year or so, and excited to meet y'all, and hopefully I can be a resource to you, and you can answer questions and talk about stuff, and I'm here to learn as well.
Yeah, well, I'll start with my question. So on the podcast we did, you talked about the length of time, and overdoing it can ramp things up maybe too much, but you were suggesting 10-minute, 12-minute sessions, maybe twice a day at the max. What are the implications of doing more than that?
Yeah, when you think of, and you're speaking of, photobiomodulation. So that's the fancy term for red and near infrared light therapy. So by shining this light onto tissue, onto the body, you modulate cell activity. And when you think about it in a couple of different ways. One way is if you have an injury or you have tissue that's inflamed, irritated, broken down, and you want that or painful, and you want that tissue to heal, then you're going to directly shine that light or that photonic energy, right? There's photons coming from the red and near infrared onto that tissue to stimulate it to heal. The other way to think about it is that when you shine the light, the term irradiation is putting light on tissue or energy into tissue. It's not, radiating it or damaging it, but so irradiation of the tissue with that light stimulates systemic responses too. So you get stem cell activation, you get increased energy in the system, in your whole body, right? So that's another way to think about it. So when you're doing that, can you do too much to one area, or can you do too much to the system? Potentially. And so there's a curve, a bell-shaped curve called Arndt-Schulz curve. And so too little is not going to do much. There is the big part of the curve, or the hump of the curve, where you're going to get most of the benefits. And then if you do too much, those benefits are going to start to diminish. The good news with photobiomodulation is it's very safe, especially with the devices that we have, or the devices that you can have at home. These class 2 devices, there's a really big safety margin. Okay, so it's kind of hard to hurt someone. What would that bad outcome be? Really, you start to get thermal effects. So you get too much heating. So if you put it on one area for too long, so say it's really close, you're depositing a high amount of energy or joules into the tissue, and you keep it on there for 30, 40 minutes, an hour, 2 hours, it can definitely cause heating of the tissue, and you're going to get some, maybe even local tissue damage. It's going to be mild, but you could get some thermal injury or burns. Okay. The same thing can happen with, say, a laser. The laser has the same wavelengths. So if you think of the red and near infrared as the medicine, right? So if we look at, say, a simple medicine like an Advil, right? So the wavelength is the medicine. So there's different medicines. You have 610, 650, 680, 670, 850, 810. Those are different things that are going to affect those tissues. And the dose is like, say you take an Advil and it's 200 milligrams or 1 milligram or 500 or 600 milligrams. That's the amount of energy. That's the dose. So that's going to be a measure of like the irradiance, how powerful the light is, and then how long you put it over the tissue. Okay, and how close that is. That's what the dose will get. So you have to be careful. So one is the wavelength, and that's the medicine, and then the dosing has those other parameters. Okay, does that make sense? So you want to get the right dose, but the good news is there's a significant margin. So anywhere 5-10 minutes with, say, a device that has a good amount of energy, and I can speak to our devices and those that are similar. If you get that type of panel with a powerful LED, that you're going to get enough dose, like for skin and superficial tissues, within 5 minutes. If you're affecting deeper tissues like tendons, ligaments, muscle, like that kind of system, or you want a systemic effect, then you're looking at anywhere to up to 20 minutes. And then you can change the area, right? So you can have if you do, say, 20 minutes on your abdomen and you want to do your back, you're getting a cumulative dose, but it's not going to be dangerous to your back, right? So you wouldn't want to do, say, 40 minutes just on your abdomen. So you could do 10 to 15 minutes, 20 minutes on your abdomen, turn around, you treat your back or treat your legs, depending on how big the device is. Now we've sourced some beds. So you have a full body dose. There you're going to be more limited because you're getting everywhere, right? So then you want it 15 minutes, and then you're done for the day.
Cool. So Katie was asking, does the amount of melanin make a difference?
No, not a huge difference. They have tested different skin colors in the dosing, and there's not a huge variance between white skin types and my skin darker. There's not a lot of variance into that tissue, so you can still stay within that zone.
Rahul, will you mind flipping your phone again in case I use it in the recordings? You're all sideways. That way we don't have to edit it. It's cool. All right. Other questions from anyone else? Yeah, Ben, go ahead.
Yeah. Well, I have all the questions. So, but yeah, so you're talking about the 15 minutes on your beds, right, or larger panels, right, and you're talking about moving these smaller panels around. If you were trying to affect deeper tissues, right, is there a max benefit, if you will, for different parts of your body, right? So, like, if you had one of your smaller panels, for example, right, I
Yes.
use it 20 minutes on my shoulders
Mm-hmm.
and 20 minutes on my legs, and 20 minutes here and 20 minutes there, right? Like, at what point is there a cumulative um, limit there, if you will, or is there some is there a max that the system can take? Is really what I'm asking.
No, you're going to, if you like with a smaller panel, smaller light, and you're moving it into different tissue, you're going to
Mhm.
activate that tissue differently. There, you will get systemic benefits, right? But you're not going to
Okay.
put yourself in harm's way by moving it around, and it's just time. It takes a, you're spending a lot of time, but that's not
Okay.
going to be dangerous to the system. If anything, you're going to get a larger systemic response. So when you're putting it on
So,
an knee or a limb, then the fat tissue in that area and the bone in that area, the stem cells, the cells that are, they're called pericytes in the fat, and there's mesenchymal stem cells in the bone marrow. Those are going to get activated, and then they're going to get deposited. They're going to get into the bloodstream. Okay, so when we talk about like stem cell activation, what happens is they kind of they're dormant, and they're waiting for signals. This is a signal, and the way that it gets activated. So imagine they're like the firefighters in the fire department, right? They're hanging out in their, chilling and relaxing, and then the alarm goes off, and they have to get into the fire engine and go, right? And so that's the bloodstream. So when they come out, they crawl out. It's pretty neat if you watch YouTube. There's some really cool um, micrographic videos that show these cells crawl into the blood vessels, and then they flow, and then they're in the bloodstream, and wherever there's injury or dysfunction, they exit. And so that's the nice thing. So we talk about the systemic response. So even after you do the light therapy within 15, 20 minutes, and then it peaks at, about 2 or 3 hours, you have this release of stem cells. So you hear people getting like for wellness or injuries, they get IV stem cells. And in this country, there's a lot of, concern about that. It's considered, by some illegal. I wouldn't want to go into that, but it's the theory of it is that, hey, you get this systemic dose of stem cells, and they can cross your blood-brain barrier. They can go to injuries that you don't even know are happening. So that's what's happening. So when you're moving that device around, you're kind of adding to that benefit, but you're also treating the local tissues to get those cells to heal, to get the mitochondria in those regions, the cells, like all the nuclear transcription factors that start to develop, the proteins that are created when you shine the light on a local tissue, you get that local benefit. I hope that makes sense.
So
uh,
I was going to just elaborate on that just a little bit, just like from the BFR world, like the prescription protocols for your shoulder is to do the BFR cuffs on your legs, because it's that systemic release is going to cause those same growth factors to go throughout the body and then be able to hit. So yeah, you're targeting local tissue, but you also have the systemic effect where you can't actually isolate the shoulder, but we're going to create that so that those stem cells and growth factors are running through the body.
so just to clarify, right? It sounds like moving the panel around is certainly not a problem, right? But I would want to stay, if I had an isolated injury or soreness or whatever, I would want to stay on that for something like 20 minutes, 10 to 20 minutes. Is that?
Yeah, 15 to 20 minutes. And you can test that. Again, it depends how close are you to the device, right? There's a inverse square law. So the farther you get away, you're losing, a square of that energy. So you want to be closer to the device. So that changes the amount of energy that's deposited into the tissue. But somewhere, 15, 20 minutes in a localized area, say a knee, shoulder, ligament, tendon region, you're going to get a nice amount of energy deposited into that tissue. And then the other benefits that we're seeing long term are, consider it kind of like microdosing. So getting a huge dose at one time is not going to be as good as getting numerous doses every day.
Let's dive into the world of optimizing your overall health. With pushing my physical limits, I encountered significant reductions in my health, and I reached out to Merrick Health as the premier telehealth service. I loved their personalized health coaching from the comfort of my home. They empower you with the choice of self-service diagnostic labs, or what I chose, the guided optimization with expert interpretations of blood work, health coaching, and with medications delivered to my door. Merrick Health is your partner in optimizing your health. Listeners can seize a fantastic 10% discount off their first blood work with code RESILIENCE at merrickhealth.com. That's code RESILIENCE for 10% off. Hey, Brian, I'm really interested in any questions that you might have given the population that you work with being, a little bit different maybe than the population that, of a lot of clients of people on the call here.
Well, I had a question first regarding localization of the therapy. Do you have protocols for like a knee or a shoulder joint, something in terms of the angle? Does the angle and the location of the panel actually affect the radiant to the specific? If I tear a rotator cuff, right? Do I have to have the panel in a certain position to optimize local therapy on the injured tissue? And it sounds like it's almost more beneficial to just do like a bed, a full body, like you were talking about the microdosing, because it affects stem cells throughout the body. So yeah, that was the question I had.
Not so much angle, it's how close it is to the tissue.
Okay.
And if you think about like the rotator cuff is a 3-dimensional structure from front to back, and it kind of wraps around the humeral head. So depending on a tear or injury can be anywhere along there. So depending on where you have the injury, theoretically, yes, the closer you have it to that tissue, the better effect it's going to have. But that's sometimes hard unless like if I was doing an ultrasound and knew exactly where the injury was, then we can place the device closer to that. But in general, when you're doing a knee or a shoulder, if you get a dose in the front and the side and the back, if you even want to do that, you could move it around kind of circumferentially. Same with the knee, right? So if somebody has knee arthritis, really what compartment is it affecting? Usually it'll affect maybe one area more than the other. So if somebody has a medial meniscal tear or the pain on the inside of their knee or some arthritis there, then maybe you want to get more dose, on the inside. If they have patellofemoral, so underneath the kneecap, if there's arthritis there, if they have pain going downstairs, those types of things, or has crepitus behind the knee, then more of a frontal approach. Maybe you spend more time in that position. Okay, does that make sense?
Yeah, it does. Thank you. I'm sorry.
Yeah, you can move it around. So even if you were saying like, hey, I'm going to do 20 minutes to a certain area or a knee, right? Then you could spend maybe 5 or 10 minutes in different positions, and you can move it around. You can move it around a little bit or move your knee. Now, as far as the beds, they are going, or a larger panel. The benefit of that is you're getting more dose systemically, right? So definitely, I like the one I have. We have multiple at home. The one I use mine twice a day. So I do about 7 to 10 minutes twice a day. Knock on wood. Currently, I'm not having any specific injuries, and I think because I've been doing this for a year now straight. I think my injuries have dramatically diminished. Okay, so I have a hyperligamentous. I don't know if you've heard of EDS or Ehlers-Danlos, Ehlers-Danlos syndrome. So if you look at my thumb, I can bend it back this way. I can touch my thumb to my wrist, my elbows hyperextend. So I'm I'd say I'm good at yoga, bad at football, and I'm a pretty big guy, but I'm about 6'1", 215 or so. So I can put on muscle, but my joints break down. And by doing this every day, my injuries in the past year have, like I said, I'm pretty happy with it. They have dramatically diminished. And Chris has been working with me a little bit on like bench press and other things like that. My shoulders sublux if I go too heavy, but I did, for the first time in my life, and I'm 50, I did 225 for 8 reps. Like I've never even come close to that because my shoulders wouldn't take it. So I've gotten really strong, and I feel like a lot more stable. And if you look at some of the data, it's really interesting on what this is doing to collagen. So they've done pretty cool studies where they actually biopsied the tissues that have been irradiated, and they looked under the microscope and they see all this new collagen production. And that's very obvious with skin, right? This is used in a lot in dermatology, but they're seeing this in deeper tissues as well. So I think for patients that are a bit, hyperligamentous or lax or prone to ligament tendon injuries, this is a fantastic tool that in the short term, I look at I kind of have 3 groups of where we use this. One is a patient that's injured that needs to heal. So we have that. One is, the athlete that wants to like truly improve like their performance. And then another is wellness, right? So that's why I love these devices at home, because you use them. Like I don't have any injury right now, but I don't want to get injured, right? So I'm continuously doing it. And for me, it's at this point, it's almost like an anti-aging, people don't like that term, but a healthy aging tool to keep me, functional, relatively pain-free. And I feel like it's really supporting my tissues, just like if you were to take a supplement or if you're doing exercise or getting really good sleep, right, or great nutrition. This is part of the wellness. It becomes a wellness habit once you're out of, say, like an acute issue. And that's where like, the larger the beds and those types of things, you can afford it. It's pretty nice, right? Because then you don't have to keep moving that device around. But the hard part is the beds are really expensive. They're really big, right? You're going to need like a 220 outlet for the powerful ones, and then so you have to find where you're going to put it in your house or your garage. And then if you have it in a clinic, or if you have it in like for a medical clinic, for me, we don't want our patients. Not that we don't care about them, but we don't want the patients coming in there every day or having to, right? So that's the challenge. Now, if it's in a gym setting or a training setting where you have people coming in, say 3, 4, 5 times a week, then a bed makes a lot of sense, right? Because they can get that microdosing. If they're only coming in once a week or a couple times a month, then I don't feel like it's the best tool in that setting.
So speaking of that gym scenario, what about pre-training versus post-training? I think there's value in both of those, isn't there?
Yeah. It's the data is a little bit challenging. There is a really good benefit of preconditioning, right? So if you use it for preconditioning, if you're going to train or you're going to perform, right, there can be a dramatic improvement in your, time of exercise limits, your VO2 max changes. There's a lot of physiologic changes that are beneficial that can occur 20 to 30 minutes after getting a full body, dose or regional dose of red and near infrared light therapy. Now, those benefits, Chris, that's the hard part. They kind of carry over also to post exercise. So if you use it for like a training session, you're going to have better, results in recovery. You're not going to have as much, DOMs and all those things. Now you can get both in the literature, and then when I've used it, like I noticed a tremendous difference. And if anybody has, the panels at home or in the gym, when I work out, and if I work out really hard, my legs always get sore. Like that's my quads, but where I get the like worst DOMs. So the late onset muscle soreness 2 days after like a heavy leg day, I'm miserable. And that's virtually gone away now if I do the light therapy after the workout. 10 minutes, stand in front of it, quads exposed, and then I turn around, hamstrings and glutes. And 2 days later, it might be 10% of what it used to be. And I've gone back and forth. So I'll exercise and I won't do it, and I'll pay for it. It's really interesting. Now, some of those benefits, I haven't tested it, that much myself, because usually I'll do it afterwards. But some of those benefits have been shown in the literature to occur even if you do preconditioning. So the potential is like if you had to choose, and you're a performance athlete, it kind of makes sense to do it before. If you have the option of doing both, you're not going to hurt yourself.
Yeah, the preconditioning seems to make a lot of sense to me, because you're also, because of the elevation and the window of elevation, you're obviously going to be at peak then post, but you're also amplifying the effects. It makes a lot of sense to me. I haven't been able to experiment just based on the timing of it fitting in my lifestyle to be able to do it in the pre-period. So I just don't know at this point personally, but that makes a lot of sense to me.
Yeah, that's exactly why I can't do it. Because it's at home. I don't have it at the gym, and just by the time I get to the gym, I'm ready. I want to go work out. It's hard to say, okay, I'm going to take 20 minutes. And now for professional athletes and different settings, I think it could make a lot more sense to do that, because you're getting the benefits during exercise, during the performance, and you're also getting those post-exercise recovery benefits.
Anthony's got a question.
My understanding is it increases the flow of electrons, so that's going to help with redox. Would it make sense then to try to do it in the earlier part of the day, because of the circadian effects of higher levels of NAD? And have you looked into using bicarbonate with it to maintain more neutral pH for the mitochondria, to improve the effects of the red light?
I have not looked at the bicarbonate, but definitely there are changes. There's some really interesting studies on circadian rhythm effects. And what they showed is there's certain mitochondria and in certain cells that will be more active in the morning. And so that's why I do mine, looking at some of the theory, I do twice a day, and it's for different effects. So in the morning, it's more of a energy boost, right? So when you're activating, so those photons hit that cytochrome C oxidase, they dissociate nitric oxide, you get improved vasodilation, blood flow, oxygen binds to that, and whatever you can do for that oxidative phosphorylation, that electron transport chain, you're going to produce, instead of when nitric oxide is bound to that cytochrome C oxidase, you produce about 2 ATP per cycle. When you have oxygen bound, it produces 32. You get a 16-fold increase in efficiencies. The certain mitochondria in the body with the circadian rhythm are going to be activated in, if you have a normal sleep pattern between, say, 8 a.m. and 11 a.m. And so in the morning, you're going to get a huge boost of energy. It's like having a full body, like coffee, caffeine, energy boost, gets you through the day. In the evening, there's a lot of other pathways, and they're still elucidating them, but there's a lot of other pathways that start to be activated, especially optical pathways. And what we're seeing is some of the parasympathetic benefits. What I notice, if anybody uses, and this has been shown in the data, and also I've tested it myself, and it's very obvious in my case, and I've talked to other patients and other folks, is looking at your sleep patterns. So if you do it a couple hours before bedtime, and if you don't do it, I notice a really big difference in the amount of REM sleep that I get, the deep sleep. I have an Oura ring, so that's what I'm tracking. And then heart rate variability. All are measures of high quality sleep. And they are dramatically different if I use it in the evening. So I like that kind of bimodal therapy. And so I try to it's hard for me to sit still. I'm not a person that just likes to hang out and sit around. So if I can get 10 minutes AM and 10 minutes PM, that's a fantastic dose for me. Getting it in the eyes, and there's a lot of discussion of, we have eye protection and those types of things. There are optical pathways, and I feel like especially, around the circadian rhythms, both morning and evening, that are really important. They did a recent study in the University of Pittsburgh Medical Center looking at red light, near-infrared light, whole body radiation, and there was a 5-fold decrease in blood clots after surgeries. It's a huge difference, and these were animal models. And what they noticed afterwards, they didn't realize that was happening. Afterwards, they looked at it, and the blind mice, or the blind rats, they did not see the benefits of the reduction in blood clot risk. And so they don't understand exactly what's happening, but there's obviously, in that setting, there's a significant optical pathway that's being encountered. So it's something to think about. So when we talk about using eyewear, like protection, I would just close your eyes. This is an extremely safe device. It's not a laser. It's not going to, cause burns, especially with the time limits that we were talking about. Don't look directly at the diodes, but if you close your eyes and get that red and near-infrared light, you're going to get some central nervous system benefits.
So
yeah, I think remember reading about the Jeffrey Institute doing some research with red light shined into the eye. I think it was a low wavelength, like 680 to 720, and improvements in dry eye and differentiation of color.
Yeah, and it's positively affecting the rods and the cones. They're very energy dependent, ATP dependent, and so they're probably the first indication that's covered by insurance was oral ulcers in chemotherapy patients in children. So it's called oral mucositis. So now that's the gold standard of treatment. It looks like a lollipop or a what's it called? I forget, I'm losing the name right now, but it's kind of like a lollipop or popsicle. And it's a red light popsicle with near infrared, and it's for little kids. They can suck on that, and it helps with oral ulcers and healing, post chemotherapy, radiation therapy. The second indication that's going to be covered by insurance is for children in myopia. And so that device is in like stage 4 testing right now. So it's definitely helpful for the eyes, but those are very controlled wavelengths and very controlled doses. And they're very short time periods and more powerful lights that are very focused. But with this, you're going to see those benefits as well.
So in the comment section here, one of our members who has a Red Vibe panel, by the way, says he has myopia and it does work. So right here on this call.
Nice.
I've got some commentary on the ramping up and the energy as well as the sleep. So I follow the same protocol as yourself, morning and evening. And I also have more recently employed a PEMF mat at the same time. And in the morning, I do that at a high frequency, energy frequency, and then in the evening, low to ramp down. But I have gone, like 1 week, I've been taking massive amounts of caffeine due to the high stress in my life and to get through my days. And I just stopped having anything other than my cup of coffee in the morning. I was having energy drinks all day long, and I was like, I feel great with this. And then here's my sleep. This is my HRV value by year. And you can see this downward trend with the stress level of my business.
Oh, wow.
And then all of a sudden this year, it spikes to the highest it's ever been immediately when I haven't completely remediated, the issues in my life. You can also see that on my resting heart rate.
Do you send those
Resting heart rate,
parameters on your
lowest it's ever been. We can also see it on my breathing, respiration rate, lowest it's ever been. Those are by years. That's not and so obviously I'm showing the short term with this year being the first, just the first quarter, the first few months, but that's when I've employed these changes. So yeah, that's pretty cool.
It's amazing. I'd love to see what your protocol is for the PEMF. I've not been in, we have it. I just haven't been using it. So that would be cool to add that into the mix.
Yeah, we've got a line of a few things that we've been testing and making some changes to that for a wellness line of products to complement the red light and other stuff and peptides that we're doing. So me and my wife are working on that. Anthony, did you have any other ones?
I'd read about, actually it was discussed at one of the Grand Rounds meetings with Dr. Seeds, the application of red light for tinnitus and pairing it with the humanin peptide because it crosses the blood-brain barrier. Have you done any research with using red light for tinnitus?
No, not really seeing too much in our practice. Mostly musculoskeletal, joint and spine issues. So really haven't done much with tinnitus. Worked with some docs like with TMJ, and that's been really effective. But that's a combination with regenerative medicine injections. So that's probably the closest to tinnitus or the ear that we've gotten.
Okay.
Ben, I see your hand raised, but I haven't had a chance to give Derek or John a chance to ask any questions yet. So I'm going to do that first. Derek, do you have any questions? We'll move on. John, do you got any?
I do have a question. Sorry.
Okay, perfect.
I was actually walking around my house listening. My bad. So I will say for other people that didn't hear it, I have myopia. It does work for it. I don't use as strong of a light. I guess my question is exactly what level of red light and green light should I use? Because the vision therapist I went to gave me a makeshift light, and I just stare straight into it, eyes open. but obviously the panel I have is much stronger. So I was just curious as to what amount of time you would spend with your eyes closed, pretty much looking at the panel.
Is it
And also have a green light panel too.
is it the 600 panel that you have, Derek?
Well, not to look back, I went with a different company because
Oh,
they
okay.
were local, and I actually picked it up. But yeah, it does. It's a Mito red light. It has like 218 lights, and it has like 11 different settings. But it does red light from like 600 to like high. I haven't even looked at it. I just turned the thing on and use it. You know, I'm 30 and I'm probably younger than most people with this, but I can say it helps with wrinkles. It helps with, like, if you know I was an alcoholic, I don't look like one anymore. You know, so I'm all about the red light for the body, but also my vision, because I was seeing a vision therapist for it. So
Yeah,
my question is, yeah, what measurement to sit in front of? My bad.
Yeah, it really depends. I mean, there are very detailed studies for myopia, so they are very specific to the the dose that you're getting. Uh, Depending on, like, again, it's very sensitive to the distance that you're from the device and the device itself, because there's a big range of like energy, how much irradiance that light source is giving, because you can get a an LED from Amazon that you could sit in front of it for 2 hours and it's not going to give any dose, right? It's the same wavelength. It's just like we talked about with, it's like taking a 1 milligram Advil that you can take, then you're not going to get any benefit from it. It's the same medicine. It's the same wavelength, it's the same color, but there's no energy. So it really depends on how much you're getting. When you look at treatments for myopia, if you were using, the Red Vibe device for that, and it's not specifically, built for that, but if you're using it for that, you would need under like 2 minutes in front of it, because the dose is so significant, right? So it's not a device that's built specifically for myopia. It can help that with that, but when you're looking at the dosing and affecting like tendons and ligaments and muscles and tissues, you want a much more powerful device or light and more dosing into the tissue, so a longer period of time in front of it. For skin, like some of the, these masks that they have, the red light masks, and some of them had near infrared, or they have green, they have yellow or blue lights in those. Those are very low power, and but for the skin, right, the light can get to it very easily. They don't have to penetrate a lot of tissue, so you can get benefits with wrinkles and other things with those face masks. But oftentimes you're looking at 30-40 minutes of dosing time, where if you get in front of the Red Vive panels, again, 3 to 5 minutes in front of that, you're going to get a really healthy dose for skin, for hair.
Okay,
Yeah,
she made like a. Sorry. Go ahead.
Oh, no, good. I've just noticed the same thing with, I'm 50 years old, and a couple of years ago, I was noticing I just started to have some age spots, probably from like sun exposure and other things. And I almost never, this is pretty cool, I almost never put it on my face. I might have done it like 1 or 2 times. I just don't do that. It's always like, I have low back issues. I have L5S1, arthritis, disc herniation, 4-5. I have a little bit of listhesis there. So I have some low back issues, and that's where I focus most of the energy. And that pain has gone away. But I noticed in my face, my skin looks better. Like, I can't even find that age spot anymore. This is like something that over the course of a year that went away. And so there's this systemic response, like it's rejuvenating the system, which is totally fascinating. Right.
So to recap, you'll say with your device or a similar device on, like, say 25 to 50% brightness, 2 to 2-ish minutes.
Yeah, 2 to 3 minutes. You shouldn't need too much more. When we look at ours, when you're 3 inches, away, we're well above 100 milliwatts per centimeter squared energy. So that's kind of a gauge. At 6 inches away, we're around 80 to 100 milliwatts per centimeter squared. So still a very powerful device. And then as you start to get farther away, it dramatically diminishes. So it really depends on how close you are to it. But if you're close to the panel with myopia or eye issues, you don't need a lot of dose. So it's not a long exposure. And even for skin, it's not a long exposure. 3 to 5 minutes should be plenty.
Well, how I do it is about 4 minutes on my face, and then I'll stand up and get my my thigh, because that's my injured area, and then I'll finish my session, and I'll do that twice a day. Because my assumption was the face skin is thinner; it doesn't need as much.
Yeah.
Yeah,
And
I
then the
got
other-
PRP, and that's what led to this. It works very well together.
Yeah, we do PRP, stem cells, regenerative medicine. It's a beautiful combination. Yeah, even before, right? So you activate the stem cells. They did a very interesting study where they took peripheral blood. They counted we can count stem cells in the blood by antigens markers on the cell surface. They're called CD34. So they're CD34 positive cells, and then they looked at macrophages, which are a type of white blood cell that can be promote healing. And they irradiated just the lower leg, the tibia, for 15 minutes. And then 2 hours afterwards, they drew blood again. And within 2 hours, on average, there was about a 300% increase in circulating stem cells. And that lasted anywhere from a day to 4 days. So what we like to do is if somebody's getting a PRP or cell therapy injection, we want to kind of dose them before, have that massive increase. So then when we're taking blood and spinning it down, we're getting more stem cells, that product. And then also you want to do it afterwards because then you're continuously kind of reinforcing that healing. So that's just one of the ways that the red mite works. We talked about mitochondrial activation. We talked about stem cells. And the last thing we really haven't talked about is pain reduction and inflammation. It works on the capsaicin receptors in the nerve cells. And so that's if you get in front of a red light panel and you feel better right away, it's because of that. So it's not magic. It's not fixing things. It's reducing maybe some blood flow effects, that it's kind of removing some inflammatory mediators in the area. But one of the powerful effects that it has is it's down-regulating and modulating the capsaicin receptor, the pain receptor in the nerves. So it feels good. So it actually acts as an analgesic. And so that's why patients, if you get 5-10 minutes in front of it and you're like, dang, my pain went away, a big part of it is that. The cool thing is, though, you keep doing that, those capsaicin receptors start to change their morphology. There's more calcium in the cells, and they start to change over time. They start to heal. And so chronic neuropathic pain can actually get better. So it actually modulates how those nerves behave. And patients that have chronic pain, oftentimes their nerves are chronically inflamed. So it's called neural inflammation. And so you're actually, by doing that, you're changing that process. So over the course of weeks to months, that pain will be reduced and it will stay reduced. And the nerves can actually improve their function. They can remyelinate. Chronic painful neuropathies can improve. So it's really fascinating. But that's where the beauty of the microdosing and continuous exposure is really important.
Some absolute gold in everything that you went through there. And man, I appreciate you taking the time with all of us today. It's just really gracious of you. I'm hoping to make some time for just 2 more questions because we didn't get to John, and Ben's had his hand raised for a little bit. So,
Tex, if you want to build more physical resilience in your life, you need to start with a firm foundation. That's why I only wear barefoot shoes. Their wide toe box, zero drop heel, and flexible frames allow me to comfortably strengthen my foot every day while promoting optimal body mechanics, postural alignment, and movement. Listeners can get 10% off by using the code RESILIENCE at barefoot.store. That's BEAR foot.store for 10% off with code RESILIENCE. Start improving how you move today with barefoot shoes.
Ben, your question?
Yeah, I was curious. You said you worked at the spine clinic, right? Or on spinal issues as well. And years ago, I was thrown and landed on my forehead and had numbness in my arms for about a week. And every now and then, I'll get a little bit of numbness in my right hand still. And I was kind of curious with that type of injury, because I can't imagine that it's something other than a spinal injury, right? Somewhere. Have you seen effects with that? And would you treat the spine with that, or more of the hand where I actually get the numbness?
Yeah, so that would be, again, that is our wheelhouse. And so the proper diagnosis is what you need, right? So like an evaluation by a spine specialist, we'd evaluate your neck. Obviously, if that injury caused that disturbance in the limb, then my at least thought is like, let's rule out something structural, discogenic? Is there some nerve compromise, nerve root injury? Was there a traction injury on the brachial plexus? And then kind of evaluate that limb. And there's specific tests that we do, both physical examination, imaging, sometimes EMG nerve conduction studies to assess kind of what's happening with the nerve. And then absolutely like that, what we see, the combination of regenerative therapies. Again, I have a 3-legged stool of regenerative medicine. Like you have to have the 3 legs so the stool works, is proper diagnosis, precision diagnosis, precision biologics, what you're using, and then precision delivery. So when we have our injury determined, then you want to put the medicine in that area. So is it a disc? Is it just the nerve? Is it a facet joint, right? We have facet joints. Could they be inflamed and irritated? Was it more like a traction or, compression injury of the nerve? So we want to assess all those things. And then now we heard today how the red light near infrared is going to help all of those things. Now, if you can get the benefit by just doing the non-invasive, like put the light on and it goes away, hallelujah, right? That's the best. We don't have to do anything. But if it doesn't, then let's dive a little bit deeper and then, look structurally what's going on. Okay. And that's why the radiology, as a radiologist, I'm super biased. So take everything I say with a grain. I like to see what's happening. Like I want to see what's the MRI, what's the ultrasound, why are we having this issue? And then let's go after it and fix it. And then why I'm an evangelist for regenerative medicine is I've taken probably 5,000 before and after MRIs showing that it heals. So it's not just that the patient tells me like, hey, this was amazing, it feels good. I'm a doubter, right? I'm skeptic. I'm like, no, why are you telling me that? Like my first cases, I scanned it again and I'm like, holy crap, it looked brand new. Like it's not supposed to happen, right? And that's what got me into regenerative medicine. So that's what we see with all these structures. So if you can identify it, that's the first step.
I do appreciate that you are always trying to disprove your theory, if you will.
Yeah.
Doing those before and after things.
Awesome. Well, this has been a really great experience. I want to thank everybody for joining, and especially Rahul, thanks for taking the time out of your weekend to answer the questions from the group. Really appreciate it, man.
Great questions. So intelligent. What an intelligent group. It's super cool. And I learned a lot as well. So I'm looking forward to the PEMF data, and I'm going to kind of bug you on that. But
all right,
I'll let you know. Wonderful weekend.
All right.
Chris, I'm going to show you what we're doing today.
Okay. Oh, nice.
So I'm at a strongman competition. I'm just helping out. You know how we are with whoever the competitors are. We just help out with whatever's going on. It's only a small event, and it's cold as hell out here.
Yeah, it looks like fun though.
Yeah. We're doing a mammoth bar, so we're expecting probably over I'm going to bet over a 700-pound deadlift today.
All right.
Probably over 800. Sadly, I'm not part of it, but I'll be doing 700 probably about 3 months, or at least that's the aim.
All right. I'm gonna follow up on that.
Yeah, you keep kicking me in the ass, telling me to get there.
All right, will do.
Thanks, Chris.
All right, have a good one.